Hello everyone, welcome to Anatomy by Dr. Vijaya. Today's video is about development of urinary system. Though urinary system is associated with the genital system, which is called as urogenital system, embryologically and anatomically they are interconnected, but I'll be doing the video separately. So today's session will be urinary system and my next video will be on the genital system. So when you see both urogenital system, as I mentioned earlier, embryologically and anatomically they are associated each other. So they develop from a mesodermal area called as intermediate mesoderm. So what is this intermediate mesoderm? So if you recall your general embryology knowledge, intermediate mesoderm is the area of the mesoderm which is, this is a section of the embryonic disc. So there is the formation of three germ layers, the ectoderm, endoderm, and in the middle is a mesoderm, and mesoderm is not formed at the midline where the neural tube and notochord are present, okay, but on either side you can see the formation of the mesoderm, and these three mesoderm, these are the sub layers of the mesoderm, that is intra-embryonic mesoderm. So the one which is near to the axis, this is the neural tube. So one near to the axis is the paraaxial, which mainly gives rise to somites. Okay, the next is the intermediate mesoderm, and the lateral most is the lateral mesoderm. So this is the area on either side will give rise to the structures of urinary and the genital system. So in the intermediate mesoderm, there will be a mass formation, especially on the dorsal side of the coelom. So on either side there will be formation of a mass, and that ridge or the mass formation will be called as, because they are contributing for the formation of the structures of urogenital system, so that will be called as urogenital ridge. So here basically I will be talking only about the urinary system. So both urinary and the genital system, as I mentioned earlier, they develop along the posterior wall of the abdominal cavity, and when you see both the system initially at the earlier weeks, they open into a common cavity which is at the terminal end of the hindgut. So that part is called as cloaca. Okay, so I would like to show in the picture here. So you can see over here, this is the embryo, and the yellow one represents the endoderm. Okay, so the terminal, so this is the foregut, and this is the midgut part, okay, and this is the hindgut part. So at the terminal end of the hindgut, you can see a dilatation or a swelling, so that's called as cloaca. So both the structures which are forming the urinary part and the genital part, initially at the earlier weeks, they enter into a common cavity called as cloaca. Now, first we will talk about the development of kidney. So, initially the kidney, there will be formation of overlapping three generations of kidney systems. Okay, so these are overlapping kidney system which are formed from cranial to caudal sequence. Okay, so initially the first to develop has a kidney system in the that is the intermediate mesoderm. They are called as pronephros. So these are cell masses which are called as a part of the kidney system, but they are totally rudimentary and non-functional. So they are like a vestigial structure. The next to develop is mesonephros. So they act as a temporary kidney system for a short time during early fetal period. Later, they will be replaced by a permanent kidney system which is called as metanephros. So there will be three overlapping kidney system. So those are pronephros, mesonephros, and metanephros. So you can see in this picture, again I would like to show this picture. So this is the area. So this is the endoderm part, okay, and this is the mesoderm part. You can see from cranial to caudal end, there will be formation of three systems. So this part is the area that is mainly at the cervical region, will be the development of pronephros. So they start, once they start appearing, later they undergo degeneration. Okay, so they start disappearing. Later there will be formation of Metanephros, and which is at the thoracic and the lumbar level, and at the terminal part you will be seeing the formation of the third kidney system, which is the permanent one, which is called as Metanephros. So these are the three kidney system developing in the intrauterine line. So as I mentioned, pronephros, they are just a vestigial structure. So there will be formation of solid cell groups in the cervical region. So by the end of 4th week, all the pronephric system, they disappear, and there will be formation of the second system, which is Metanephros. So as I mentioned earlier, Metanephros, they act like a temporary kidney, okay, for a just during early fetal period. So for a time being, they'll be functional and they act as a kidney system. Once Metanephros develop, they disappear. Okay, so as I mentioned, that Metanephros mainly develop from upper thoracic to upper lumbar region. So you can see in the picture over there that there will be formation of a, I can show in this also. So you can see, so this is the mesonephric part. So they lengthen, since temporarily they will be functional. So they lengthen rapidly. They form an S-shaped loop. Okay, so these are the tubules forming that S-shaped loop, and they acquire the blood vessels, the capillaries which are developing in the mesodermal tissue. So they acquire some of the capillaries. So those capillaries will form the glomerulus, and the tubule which is surrounding that glomerulus will be called as Bowman's capsule, and this will act like a tubule. Okay, so laterally you will be seeing the tubule, and medially you will be seeing the glomerulus with the Bowman's capsule. Glomerulus is nothing but the capillaries. Okay, and the surrounding area is the Bowman's capsule. Later, this tubule, most of these glomerulus part and the Bowman's capsule will disappear, but in males, especially in males, these tubule, the S-shaped tubule, will remain, and majorly it contributes for the formation of duct system in the male genital tract. Okay, so these tubules will be called as mesonephric or Wolffian duct. Okay, so majority of the tubules and ducts disappear, but few remain, especially the caudal one. As I mentioned, mesonephric tubules are formed from thoracic to lumbar region. So entire tubules doesn't remain in males. Only the one which is at the caudal part near the lumbar region, they remain in males, and they give contribution for the formation of genital system. So those tubules will be called as Wolffian duct or mesonephric duct. But in females, all the tubules will disappear. The next permanent and the definitive kidney system to form is the Metanephros. Okay, so this is a third urinary organ, the permanent kidney. So around 5th week, they start appearing. But here, these Metanephric, it is not just like how you saw the development of Metanephros. So there was glomerulus, it acquires glomerulus, Bowman's capsule, and then they form tubules. But here, Metanephros, though they appear at the 5th week, they appear like a blastema, metanephric blastema. So you can see in this picture here, so the black one representing here. So this is the cloaca, where the two urogenital system are opening into it. Okay, so even the cloaca undergoes division, okay, anteriorly and posteriorly. So that I will be talking later. Okay, so the black one represents the metanephric part. So it forms a mass over there. So this mass will be called as metanephric blastema. Okay, so this mainly contributes to the formation of excretory system. Okay, but the collecting system mainly develops from a bud which is coming from the mesonephros. Okay, the mesonephric duct. So this is the mesonephric duct. As I mentioned earlier, some part still remains. Okay, so at the caudal end, there will be a small outgrowth. Okay, so this is called as uretric bud. So this mainly gives rise to the collecting system, and the metanephric blastema, this black one, mainly gives rise to excretory system. Okay, so what are the structures which comes under excretory system and the collecting system? Okay, the excretory system, that is, which is developing from the metanephric blastema includes Bowman's capsule, proximal convoluted tubule, loop of Henle, and distal convoluted tubule. So these are the part of the excretory system developing from metanephric blastema. The next, that is the collecting system, mainly develops from the ureteric bud, so which includes renal pelvis, which is the first part of the ureter, then the ureter, then the major and the minor calyces and the collecting tubule. So these all will be coming under collecting system. So they develop from ureteric bud. If you go to the picture over here, so this is showing the development of the ureteric bud. As I mentioned earlier, ureteric bud is an outgrowth from the mesonephric duct at the caudal end, and slowly this ureteric bud penetrates the metanephric blastema. So if you can see, this one represents the metanephric blastema, and this is the ureteric bud. So this is an outgrowth from the mesonephric duct. So this ureteric bud slowly penetrates the metanephric blastema and immediately it dilates and divides into two buds, so which will later forms the part of the collecting system. So when you see this, initially there will be two buds, there will be further branching of these buds. Okay, so there will be subdivision. So this subdivision goes on till the 5th month. Okay, and so the subdivision will go around 12 or more generations, and this mainly gives rise to, so if you can see, this part is the renal pelvis part of the ureter. So this is the ureter part, and here you can see this is the division of major and the minor calyces. So here these are the major calyces. So as I mentioned, so the division will go up to 12 or more generations. Okay, and there will be absorption of, mainly the second one absorbs the third and fourth, which mainly gives rise to all these minor calyces. So they mainly gives rise to minor calyces, and the distal subdivisions of those generation later forms the collecting tubule. So in the picture you can see mainly it is focusing the fourth, that is representing D over there. So you can see the further divisions, the further generations of which are at the distal end penetrating the blastema. So they will later form the collecting tubule. So now you can correlate with the gross anatomical feature of the kidney that all these collecting tubules later gets connected with the excretory system which are developing from the metanephric blastema. Okay, so these are connected with the distal convoluted tubules, and collecting tubules, whatever the urine is formed, they enter the minor calyces, minor to major calyces, then from major to renal pelvis, and then it enters the ureter. Okay, so this you can correlate with the internal features of the kidney. Okay. Okay, now coming to the development of the excretory system, which is from the blastema. So here you can see this is the ureteric bud. So they are branching, they are subdividing into different generations, and each bud will be surrounded or molded by a cap of metanephric tissue, that is from the metanephric blastema. So they cap around these buds and they form at certain areas, it forms vesicles, and these cap which is surrounding the bud, later they undergo S-shaped loop and they elongate, they lengthen, giving rise to the parts of the excretory system. So you can imagine here, so here this part is the ureteric bud, so distal part mainly gives rise to the collecting tubule. So this will be connected to the metanephric tissue. So this part mainly forms a distal convoluted tubule. They are continuous with loop of Henle. Then that will be continuous with proximal convoluted tubule, and at the distal end of the proximal convoluted tubule you will be seeing the Bowman's capsule, which will acquire the capillaries surrounding there, and that forms the glomerulus. So you can see in the picture how the elongation takes place and how the excretory system will be continuous with the connected with the collecting system. So let us know some of the clinical applications related to the development of the kidney system. So one of them is multicystic dysplastic kidney. So it's a genetic disorder. So So this can be accompanied by, means it can be a syndrome along with the abnormal development of digestive tract or abnormal development of nervous system or any other parts of the urinary tract. So here what happens, there will be formation of undifferentiated cells from the metanephric blastema. So there will be abnormal induction of metanephric blastema, and also sometimes there might be failure in the formation of urethric bud. The urethric bud, there can be outgrowth, but they don't branch out or they don't undergo subdivision. So that leads to a condition called as when there will be formation of multiple cysts. Okay, so the nephrons won't develop. So this leads to a condition called as multicystic dysplastic kidney, and definitely the babies who present with this disease have to undergo dialysis because the kidney system is not functional, and within first year of life they have to undergo renal transplant. The next clinical application is renal agenesis. As I mentioned earlier, in the normal development, though the excretory system and the collecting system, so excretory from metanephric blastema and collecting system from urethric bud, though from a different embryonic tissue, though they develop from different embryonic tissues, there is an interaction and connection between these two. Okay, but what happens in renal agenesis? This interaction fails to develop. So there is no interaction between metanephric blastema and urethric bud, and that leads to a condition called as renal agenesis. The next clinical application is the polycystic kidney disease. So there are two types. It's a autosomal disorder. So there are two types: autosomal dominant and autosomal recessive. So among these two, autosomal dominant is most common. It's a type of adult variety where it can be presented later in life. So as I mentioned, autosomal dominant is the most common one, but there can be condition called as autosomal recessive polycystic kidney disease. So here the kidney around the collecting tubules, okay, there will be formation of different cysts which are filled with fluid, okay, and as you can see in the next slide, okay, so this is how in the second picture there will be many cysts around the kidney. The collecting system has developed, even the kidney has developed, okay, that is the excretory system, but there are many cysts which are filled with fluid, okay, so this condition is called as polycystic kidney disease. The next clinical aspect is the presence of complete or a partial double ureter. So here what happens, as I mentioned, you know that ureter develops from the urethric bud, right? So urethric bud, so this is the urethric bud, so they undergo division. Sometimes the splitting of the urethric bud occurs very early before it penetrates the metanephric blastema. So there will be early splitting of urethric bud, okay, so this sometimes can lead into formation of double ureter. Sometimes the splitting of the urethric bud, the two ureters might have separate metanephric blastema forming two kidney, the excretory system and the collecting system, or sometimes there will be one excretory system, but the ureter formation will be two, okay. So this condition is called as double ureter, so it can be complete or partial. Now that's about the clinical application. The next part, the position of the kidney. As you know that the normal development takes place at the hindgut area, which is at the pelvic area, the lumbar region, okay. So due to the changes in the body curvature and also the development of different other structures in the lumbar and the sacral region, so the kidney undergoes ascent, okay. So there will be ascent of the kidney. The kidney moves cranially and occupies the lumbar region, okay. So initially it develops at the pelvic region, so later undergoes ascent. There will be ascent of the kidney which occupies the original position, which is at the lumbar region, okay. So initially during early development, during pelvic area, in the pelvic area, they get the blood supply from the pelvic branches of the aorta. As the kidney ascend, then the kidney will be supplied by the arteries at that particular, that is the renal artery which is branching from the aorta, and the other branches which is at the pelvic area, they undergo degeneration, okay. So they disappear, but sometimes they might remain, okay. So this is the position you can see in the picture. 5th week it is at the pelvic area. As it reaches to 6th, 7th and 8th week there will be complete ascent, okay, and then it reaches and it joins with the adrenal gland, okay, which is present, which is developing at the lumbar region, thoracolumbar region. So during the ascent, there can be some abnormality. Sometimes one kidney might ascend, the other one remains in the pelvic region. So this is called as pelvic kidney. Or sometimes when they are pushed up, okay, so they might be pushed very close together, and most commonly the lower pole of the kidney might fuse, okay, and then they ascend. So usually the most common is the lower pole. So when they are ascending, when they are pushed together, they might be very close together, and the lower pole might fuse, and this leads to a condition called horseshoe kidney. The ascent of the kidney is stopped by the presence of inferior mesenteric artery, which you can see in the picture. I have put up in a blue color box. So the lower pole is stopped since the lower pole has been fused. So the ascent might stop at the level of branching of inferior mesenteric artery. So this leads to a condition called as horseshoe kidney. Now coming to the development of urinary bladder and urethra. As I mentioned earlier that both the urinary system and the genital system initially earlier week they enter into a common cavity called as cloaca, which is at the terminal part of the hindgut. So this cloaca during 4th to 7th week they undergo division by the formation of a septum called as urorectal septum. Okay, so you know that cloaca is a part of the hindgut, the terminal part of the hindgut, which is endodermal in origin. So they are divided into anteriorly urogenital sinus and posteriorly anal canal. So these two are separated by a septum called as urorectal septum. So similarly, you can see the septum formation. If you go back to my video on GIT, okay, gastrointestinal tract. So there is separation even in the respiratory tract. There is separation of trachea and the esophagus by a septum called as tracheoesophageal septum. Similarly, at the terminal part, the cloaca is divided by urorectal septum. So anteriorly urogenital sinus and posteriorly anal canal. So this urogenital sinus, they are distinguished into three parts. You can see in the picture, okay, so the upper part is called as, mainly it gives contribution to the formation of urinary bladder. Okay, the middle part will be called as a pelvic part. So this mainly contributes in the formation of the membranous and the prostatic part of the urethra in males, and the terminal part which elongates in the male, which is called as phallic part, giving contribution to the development of penile urethra. So when you see the lower part of the urogenital sinus, which is phallic part, there is a great difference in the development when compared to both sexes in male and female, which I will be talking in detail in my next video on the development of genital system. So right now we will mainly focus on the upper part, that is, which is giving rise to the bladder, and the middle part which will give rise to membranous and the prostatic part of the urethra in males. So the bladder, which is developing from the upper part of the urogenital sinus. So as I mentioned that the ducts, that is mainly the ureteric bud, are opening into that. Even the mesonephric duct are opening into that. So you know that ureteric bud is just an outgrowth from the mesonephric duct. Later these mesonephric ducts are completely absorbed into the urogenital sinus, and the ureteric bud separately opens into the posterior wall of the urogenital sinus, that is the upper part. So the opening will be separate. Okay, so in the picture you can see the blue one represents the mesonephric duct and the yellow one is the outgrowth from, that is the ureteric bud. So this is in the initial stage. Later the ureteric bud has the growth further increases. The ureteric bud separates out, and due to the ascent of the kidney, even the orifice, the ureteric orifice, will also ascend little bit cranially into the, that is to the posterior, the posterior wall of the urogenital sinus. And the mesonephric duct, most of it gets absorbed and they are present. So they mainly, these absorption, the incorporation of the duct and the ureter will form the trigone of the bladder, which is mesodermal in origin. So, you know that urogenital sinus is from the cloaca, which is endodermal origin. So, the rest of the mesonephric duct, most of it gets absorbed, and in males, these mesonephric duct will later become the ejaculatory duct. Okay, so this is later it gets connected with the other duct system of the male genital tract, that is vas deferens, which I will be talking in detail when I go through the development of the genital system. Okay, so right now you remember the ureteric orifice, they separate out and they move little bit cranial due to the ascent of the kidney. Okay, and the mesonephric duct, they move close together to enter the prostatic urethra part, which is developing from the middle part of the, that is the pelvic part of the urogenital sinus. Okay, and the ducts, the part of the duct, the terminal part will form the ejaculatory duct, and most of the mesonephric ducts are absorbed and they form the trigone of the bladder, which is mesodermal in origin. So, this is the development of urinary bladder. Okay, and as I mentioned, the middle part of the urogenital sinus, mainly in males, they narrow out, which will give contribution to for the development of membranous part and the prostatic part of the urethra. So, again in this slide, I have summarized the bladder development. Mucosa of the trigone is mesodermal, lined by endodermal. Okay, so there it is mesoderm, but later the endodermal epithelium they cover up. Okay, so they have a lining of endodermal epithelium, and the remaining surface is mainly from the cloaca, that is from urogenital sinus, which is endodermal in origin. Urethra, when both sexes they differ. If you can see, the urethra in female is very small, very short, it is around 4 centimeter. So, in both the sexes, the epithelium is from the endoderm, that is from the middle part of the urogenital sinus, but the surrounding tissue and the smooth muscle, they are from the visceral mesoderm. Visceral mesoderm is mainly, that is the lateral mesoderm, which will separate, which will divide into the somatic part and the splanchnic part. The splanchnic part of the mesoderm is called as visceral mesoderm. So, they form a covering, forming a surrounding, connective and the smooth muscle tissue. So, this is the overall the summarization of the development of bladder and urethra. The phallic part further we will be learning in my next video on the development of genital system. So, in this picture again you can see the different parts of the urogenital sinus, the ascent of the ureter due to as a result of ascent of kidney, okay, formation of ejaculatory duct, okay, and around the middle part in males there will be proliferation of mesodermal tissues, which will later give rise to a gland called as prostate gland. So, these are some of the clinical applications. So, in the previous picture you can see the bladder, which is from the upper part developing, they have a connection with the structure called as allantois. Again, allantois, you can go back to my video on general embryology, that there is a small outpocketing from the hindgut area, okay, that doesn't have any function. So, that part is called as allantois. So, this allantois, due to further development of the embryo into fetus, so it has connection with the developing urinary bladder. So, this allantois later narrows down, okay, they undergo obliteration and they form a fibrous structure called as urachus, okay, so which is connecting the bladder, that is the apex of the bladder, with the umbilicus. So, sometimes what happens, the allantois may not undergo obliteration, so they remain, they persist, and this leads to a condition called as fistula. So, what do you mean by fistula? Fistula is nothing but an abnormal connection, right? So, here this is an abnormal connection where the bladder is connected, okay, and the urine, whatever it is collected in the bladder, may pass through this fistula, urachal fistula, if the allantois persists, and might pass through the umbilicus, okay. Or sometimes the fibrous cord is formed at the terminal end, that is the proximal and the distal, but at the center, at the midline, there might be a fluid-filled cyst, which is called as urachal cyst. The allantois might remain at the middle part, at the center part. This leads to a condition, there might be a swelling at the abdominal region. So, this condition is called as urachal cyst. Or sometimes what happens, there might be a condition where the end which is connected to the bladder might undergo the obliteration and they form a fibrous tissue, but the rest of the allantoids may remain and they might form a sinus called as Urachus sinus. So these are the different types of clinical application related to the allantoids and Urachus. Okay, it can be urachal fistula or urachal cyst or urachal sinus. There is one more condition called as extrophy of the bladder. So here what happens, the bladder has developed, but it is exposed externally due to the abnormality in the development of the body wall. Okay, so the ventral body wall. So if you see the lateral body, they have to fuse at the midline and they should form the ventral body wall. So if there is any abnormality, okay, and failure in the formation of ventral body wall, so this leads to a condition called as the bladder might be exposed externally, and this is called as extrophy of bladder. So this might be accompanied by a condition in the penis called as epispadiasis. Again, the dorsal aspect of the penis will be open. Okay, so this can be accompanied with the condition called as epispadiasis. Okay, sometimes the bladder might not develop. There might be a common cavity which remains, which is called as cloaca. Okay, and this might also be exposed externally. So this condition is called as cloacal exostrophy. Okay, so all these are very rare, and this might be accompanied with other clinical conditions. So any other system might be involved along with these clinical conditions. Okay, so this is about the development of urinary system. So I'll have one more video on the development of genital system. So thank you very much.